The world of children is one with smiles, cheers, cries, and excitements. But if any child is deprived of these, the entire house sings a silent song, losing emotional balance. The absence of such natural traits of children may be a sign of autism. Every year we celebrate Autism Day on 2nd of April, and the entire month is dedicated for autism help, care, and cure. Autism is a neurological disorder which affects the person's ability to communicate and interact with people. Human beings have a highly developed brain and nervous system, which is responsible for the superior intellectual and behavioral patterns. Our brain constantly receives numerous sensory impulses from our eyes, nose, ears, tongue, and skin, and it analyzes, coordinates, and helps us to identify, observe, and understand people's expressions, language, and behavior. In autism, there is a 90% sensory impairment which leads to disruption of the child's ability to understand the external environment, thus affecting the development of person's communication and social interaction skills. What is ASD? Autism spectrum disorder is the name for a group of developmental disorders. ASD includes a wide range of symptoms, lack of skills, level of disability, hence called a spectrum disorder. The name autism is derived from a Greek word auto, means self. The disorder makes the child live in his self-derived life rather than communicating with surroundings. In 1943, Leo Kanner first identified and named the syndrome as infantile autism. Worldwide research shows that autism is primarily a genetic disorder, but we can't deny the environmental influence on autism. The exact cause of autism is still unknown. Some facts about autism. Autism is the fastest growing serious developmental disability in the world, with the current annual growth rate of 10 to 17%. More children will be diagnosed with autism in this year than with AIDS, diabetes, and cancer combined. 1% of the world population is currently suffering from autism. According to American Center for Disease Control and Prevention, the prevalence of autism increased from 1 out of 125 children in 2004 to 1 out of 68 children in 2014. Boys are 4 times more prone to autism than girls. It's found throughout the world in families of all social, ethnic, and economic backgrounds. There is no proper medical cure for autism. Autism remains throughout a person's life, although with proper treatment and intervention symptoms can lessen. Probability of second twin being diagnosed with autism is more after first one is diagnosed with autism. Virus infections, thyroidism, diabetes, addiction to alcohol or drugs in mothers can increase the risk of autism in children. If diagnosed early and treated medically along with cognitive study, autism children can lead a more interactive life. How can we evaluate autism symptoms in children? As a parent, you are in the best position to spot the earliest warning signs of autism. You know your child better than anyone and observe behaviors and quirks. Regression of any kind is a serious autism warning sign. Some children with ASD starts to develop communication skills and then regress between 12 and 24 months. For example, the child who used to say mama, papa or bye-bye etc. may stop using language entirely. Any loss of speech, babbling, gestures or special skills should be taken very seriously as regression is a major red flag for autism. Early signs of autism in babies and toddlers. The child doesn't make eye contact with mother while feeding, doesn't smile when smiled at, doesn't respond to his or her name or to the sounds of a familiar persons, doesn't follow objects visually or follow the gestures when you point to the already known objects, doesn't point or wave goodbye or use others' gestures to communicate, lack of response to cuddling or familiar voices, can't imitate others' movements or facial expressions, and doesn't reach out to be picked up. The following delays have to be evaluated by by 6 months, no big smiles or other warm or joyful expressions. By 9 months, no back or forth sharing of sounds, smiles, and other facial expressions. By 12 months, lack of response to name, no babbling or baby talk, no pointing, showing, or reaching for objects, or waving goodbye. Some of them may use elders' hands as a tool to point the things they want. By 16 months, no spoken words. By 24 months, meaningful two-word phrases that involve imitation and repetition may not be uttered by these children. The developmental symptoms seen in autism children from birth to the age of 18 months. Difficulty in drinking milk, doesn't respond to cuddling, reach out to be picked up, or look at their mothers when being fed. Increased temper tantrums, excessive crying, or no crying at all. Disinterested in people and unaware of surroundings. Repetitive movements such as hand flogging, head rolling, or body rocking. Unusual attachment to objects rather than persons. Adhering to the strict routine and getting upset when routines change. Even change of furniture can lead to a temper tantrums. Decreased sleep or sleep disorders. They prefer to stay alone or with one friend or attendant rather than with group of people. They find difficulty in speech. They can't imitate others, and expressions may not correspond with their words. Autism is a spectrum condition. This means that every person with autism is unique but not different. They are a part of normal society. They can hear, speak, and feel like us, but their brains compute things in a different way. For instance, some solve puzzles from backside. It's therefore essential to spot autism as soon as possible, because after 6 years of age, children's brain may recover only 20%, whereas early intervention, that's between 2 to 3 years, the recovery chances are 80%. Our children are the apples of our eyes, but our love shouldn't tend to ignore or overlook the physical or psychological disorders in them. It's the prime responsibility of the parents to ensure their overall health and growth. Birth to 6 years of age is considered to be the golden period of life, wherein proper therapy and interventions have more efficacy and can arrest many developmental deviations. If once the autistic symptoms are recognized, one has to take the help of a pediatrician for diagnosis. Psychology is another branch of science which can come to the rescue of the autistic sufferers. A wide range of psychology specialists or professionals like a psychologist, psychiatrist, and neurologist, physiotherapist can aid the autistic children. Homeopathy is also another medical branch coming up with the solutions to this problem. Out of all these, the special education with scientific basis is turning out to be of greater success ratio. Another ray of hope for treating autism is the establishment of special schools to meet the new challenges. These remedial systems include special education with 1-to-1 ratio for those with learning problems, speech therapy for those with speech impairment, behavioral therapy for correction with behavioral concerns, besides occasional training and enhancement of life skills, catering to one's exclusive needs and demands. All these measures, together with proper medication, enhance sociability and communication of autistic children and make them partners of growth. There is never a problem without solution. Parents and family members need awareness and start early intervention. Know that there are many treatment options, social services and programs, and other resources that can guide and help the families with autistic persons. www.autism.school, autismhelp.in or search portals compiling all the available research and information about autism. Who are the partners of the rescue team of autism? Of course, parents can't be left helpless in this lifelong struggle and challenge. If we think with our heart, we can't but understand the prediction for a child being diagnosed with autism is at a much higher risk than that of being diagnosed with cancer, diabetic, or cardiac problems, wherein different types of treatments are available. A united and pooled up efforts by the government, NGOs, medical practitioners, medical students, besides pediatricians in particular, can lead to combat autism. The families in the neighborhood should show a positive concern towards autistic children and prevent social alienation. Medical students can tour rural areas, conducting awareness camps and identify autistic cases, thus collecting primary data. The pediatricians at town levels can only reach to the grassroots. So they must be kept abreast of latest developments in the field through meets, conferences, and knowledge sharing. Only then early intervention and diagnosis is possible at grand scale. It's not easy or feasible for all the people to take specialist services at big cities. To make the autistic members a part of society, enhance their social participation, everyone should recommit to the cause of autism. Special budget allocation must be implemented for special education, transport, housing and employability of such sufferers. Let's commit ourselves to the cause of autism help and cure. No religion is greater than humanity. Service with love and compassion is the greatest boon to all types of challenges. Let's together involve ourselves, granting them a world of love, emotions, language, imagination and communication. Let's liberate the millions of children